Welcome to another hour of Experts on Call on News Talk 580 CFRA. Get expert advice on a variety of topics. Ask questions, get answers.
And a good afternoon to you once again. This is Dave Watts with you. And this hour on Experts on Call, we're going to get back into our health file and learn about a common condition that affects many of us, regardless of age or gender. And I'm pleased to welcome back our good friend, Dr. Hassan Sannoufi. He's the co-founder of La Vie Executive Health. Good afternoon, Dr. Sannoufi.
Hello, good afternoon, Dave. How are you doing?
Fine and dandy. Nice to see you again. Great to see you.
Nice to see you too.
And also in studio, pleased to welcome our special guest, or your special guest. Our special guest is fine. Dr. Ahmed Kadhim, an Ottawa-based gastroenterologist. Good afternoon, Dr. Kadhim.
Good afternoon, Dave. Good to be here.
Nice to meet you. And I think we're going to have a great conversation this afternoon. This hour, we're going to be talking about irritable bowel syndrome. And we're going to talk about gastrointestinal cancers as well along the way. Certainly, as I say, it's going to be interesting. But first off, Dr. Sannoufi, for those who are unaware, perhaps a reminder for our listeners about some of the background info of La Vie Health. You folks have been around for a while, maybe your involvement and some of the services provided.
Yes, certainly. So we started La Vie exactly 12 years ago. Mm-hmm. Our first location, which is still up and running in the Brook Street Hotel in Canada. And now we have added new location about 6 or 7 months ago in downtown, core downtown Ottawa, on Slater and Kent, 275 Slater. We are our plan is even to expand further to open a third clinic. We're considering an area like Lansdowne Park area.
Oh, terrific!
We're hoping we will achieve that by 2020. Now, luckily, we've been growing since for the last 12 years, and our specialty is proactive, comprehensive, and now also we have added multidisciplinary care for our Ottawa patients.
One of the things that I like is your mission statement, which is basically predict to prevent. I like that because if you're feeling great, it doesn't mean that you're out of the woods. You really should have that checkup and perhaps look down the line to what might be happening.
That's true. You see, this is the objective of La Vie in terms of our services. Our goal is early detection and prevention rather than providing patients with reactive care, which is unfortunately this is not uncommon in Canada nowadays, given our healthcare system setup. Mm-hmm. Patients tend not to have the care unless they start experiencing symptoms. However, our vision, as opposed to that, is to identify medical issues before they become symptomatic and rectify those issues before it becomes a problem.
An issue. Now, you have wellness plans for the individual. You have wellness plans for organizations like companies, and it's certainly a good idea if you're a diplomat just new into the city and you need some kind of health advice or consultation to give La Vie a call.
You're right, Dave. We have added several services since we started. So now we also have a virtual virtual care app where patients can log in securely to their smart technology and discuss their healthcare issues with any given healthcare provider. And we also now have established a relationship with several specialists in Ottawa, including also we have signed an agreement with Claxon Hepburn Hospital in Ogdensburg, where we can expedite consultant visits literally within a week time. Also here in Ottawa, we can provide access to several specialists within a week period of time, which is obviously unheard of here in Ottawa.
Absolutely. And one of those specialists, as we mentioned, is in the studio with us, Dr. Ahmed Kadhim. Dr. Kadhim, as I say, nice to meet you again. And Dr. Sannoufi, you touched on Ogdensburg for a second, but you are a partner with or an associate of La Vie Health here in Ottawa. Maybe you could give some of your background to us.
That's right, Dave. It's good to be here again. I'm from Ottawa, did my gastrointestinal training at the University of Ottawa. Then I did an additional training in gastrointestinal motility at the University of Toronto. Currently, I'm affiliated with La Vie and Claxton Hepburn Medical Center in Ogdensburg, New York. Mm-hmm. And we work back and forth that way.
Now, this is a big area. What exactly is a gastroenterologist?
So it's a specialist that focuses on the gastrointestinal health. 33 plus feet of your gastrointestinal tract, in addition to your liver, pancreas health, stomach, and also a big component of it is prevention. So detection of cancers, maybe colon cancer, pancreatic cancer, gastric cancer, and also treating disorders such as inflammatory bowel disease, Crohn's disease, ulcerative colitis, but also irritable bowel syndrome, which is a very big disorder, and it's very common.
Let's talk about IBS. What triggers it at this point?
You know, the jury is out on that, but there are theories out there, and it's multifactorial. So, so first of all, what it is it's a disorder of the gastrointestinal tract where the patient would feel excessive bloating, left lower quadrant abdominal pain, some nausea, some flatulence, and also changes in bowel habits. It's estimated that 1 in 7 individuals have that disorder. It also has a predominance 2 to 1, females more than males, and it compromises about 40% of the gastroenterology practice. Wow. So what causes it? You know, there are multiple factors. One, which I believe is essential, is the diet. The field of diet is changing with all these, different diets that patients follow. Another component is the bacterial, or we call it the biome, gastrointestinal biome, where there is an imbalance in the bacteria that composes your gastrointestinal tract. Another theory is the stress level, where when we have a lot of stressors in our lives, our cortisol level goes up and causes symptoms to happen. And another theory is called visceral hypersensitivity, which means the nerves in our gastrointestinal systems are very vigilant and hyperactive, and they perceive pain at a lower threshold than the average individual.
Now, is this condition hereditary, or is it just environmental issues, as you mentioned?
It's a combination. So they say there's a 40% chance that if your first-degree relative has it, you will have it. And a lot of times you see a mother having irritable bowel syndrome, and her daughter ends up having irritable bowel syndrome as well. So there is definitely a genetic correlation. But also the other hit is environmental, outlining the things that I mentioned earlier, diet being the primary component.
I guess there are various triggers, and they probably vary from person to person.
Yes, absolutely. Stress level is a factor. Also, it's associated with conditions like migraine headaches and fibromyalgia. So that also tells us that the nerves are hypersensitive and hyperactive. Also, the imbalance in the bacterial structure and makeup. So depending on which diet you grew up consuming, depending if you eat the wrong thing. So all these factors come into play.
Lots of things to talk about when we continue on News Talk 580 CFRA. Our guest in studio this hour, Dr. Hassan Sannoufi. He's the co-founder of La Vie Health, and his guest, Dr. Ahmed Kadhim. He's a gastroenterologist, and the website to note, laviehealth.ca. Experts on Call. We'll be right back on News Talk 580 CFRA.
We'll return with more Experts on Call on News Talk 580 CFRA. Now back to Experts on Call on News Talk 580 CFRA.
Dave Watts with you this hour, and our guests, Dr. Hassan Sannoufi, the co-founder of La Vie Health, and Dr. Ahmed Kadhim. He's a gastroenterologist. The website, of course, to remember, www.laviehealth.ca. And during the break, we were chatting, Dr. Sannoufi, you must be quite pleased to have someone like Dr. Kadhim with you in your area, in your office area.
You're absolutely right, Dave. The thing is, we've been looking for a gastroenterologist who has specialty in motility and IBS for quite a few years. Unfortunately, there's none in Ottawa. And this is a very critical specialty because it's an endemic problem, gut issues, digestive issues, and it's commonly dismissed or not addressed properly or in details by general gastroenterologists. So you need a specialized gastroenterologist who understands IBS and motility issues and gut issues in more details and in depth, with obviously a fellowship that addresses this. And certainly, finally we found Dr. Kadhim, and we're quite pleased having him at La Vie.
So if some of your patients or anyone wants to consult with or perhaps meet with Dr. Kadhim, best way to do it is through Levy Health.
Yes, absolutely.
Okay, perfect. That's good. Now, Dr. Kadhim, before the break, we were talking about a number of things, and I find this extremely interesting. Can IBS be aggravated by lifestyle patterns or issues?
Yeah, it can very well be, stressors, and obviously we all have stressors in our lives, but stress definitely exacerbates symptoms. There is a strong nerve connection between the brain and the gastrointestinal tract. In fact, there is more nerves in our gastrointestinal tract than our brain. So anytime we're under a high state of anxiety and stress, it will definitely exacerbate symptoms.
Interesting. Now, can IBS lead to other issues, or conversely, can other health issues lead to IBS?
They certainly can. There's an overlap between conditions that may cause bacterial overgrowth, even though it's a separate entity, but it may lead to symptoms associated with IBS. We know that there is a correlation, as I mentioned earlier, with fibromyalgia, migraine headaches, nerve-modulated conditions. So there is certainly a correlation there.
What is celiac disease? Now, is that a part of it, or is that something separate?
So that's something separate. Celiac disease is more of an autoimmune entity where the immune cells in our small intestine don't like the fact that we consume gluten. And gluten is a food substance that you find in wheat, barley, rye, and some oat. And it triggers a reaction. But the symptoms do overlap with IBS in the sense that some patients may develop bloating, some patients may develop constipation, abdominal cramping. But there is definite tests that we can test for celiac disease.
Okay, all right. So does that pick a demographic or a gender, or is it just universally there?
Interestingly enough, Dave, it's common it's common with everybody, but you see it more often in patients from Irish descent.
Really?
I'm not sure if there is a genetic component. There's definitely genetic testing that we can test for celiac disease. Will tell us the susceptibility, but that demographic seems to be commonly influenced by celiac disease.
Before we started this afternoon, we were discussing a number of things, and you brought up a word that I hadn't heard before. Perhaps you can enlighten us on it. Motility. What is that?
So motility is the field that refers to the contractibility of the GI tract. So some individuals may have hyperactive gastrointestinal tract in the sense that they're overactive, so that leads to things like diarrhea. Things that are slow, contractility or motility, things like constipation. There is also esophageal and swallowing disorders. Sometimes when a patient is having a hard time swallowing, the food gets stuck in the stomach or gets stuck in the esophagus, and that also has to do with motility. So our job is to analyze the conduction of the nerves that allow the motion of the food to go through this hollow tube that we call the gastrointestinal tract.
So it's a pretty, I would say, rounded example of issues, or it helps to bring issues to the forefront that might be present.
Absolutely. There are multiple tests that we can do to check for the motility disorders, and there are medications that can enhance motility or slow down motility in the gastrointestinal tract.
Now, IBS generally, is it age-specific? I mean, are children at risk?
It's not very common in children. The most common age is in the 40s, even though it can happen at any age. A lot of times, teenagehood. When the child goes through teenagehood and undergoes a lot of stress, whether it's school or social aspects, that can also initiate that disorder. So it's a wide range, but mostly we see it in the mid-40s to 50s.
Okay. You had mentioned earlier that it's higher possibly in women. Why is that?
We really don't know the answer to that. There are a lot of theories out there. Sometimes the anatomy of the female is different than the male in the sense that if you look at their abdominal space, there is a uterus and there is a fallopian tube, and sometimes that might cause some anatomical glitches in the colon. But for the most part, we don't really know why that is.
Okay. Now, what about symptoms? I guess abdominal pain, bloating, and constipation are ones you've mentioned before of IBS. Is there anything else that should be in that package as well?
Well, first of all, very important, Dave, to rule out what we call red flags. So I really don't suggest you diagnose yourself with IBS. It's really important to make sure that there is nothing serious that can cause these symptoms. Obviously, our biggest worry is cancer of any sort or mucosal disease like ulcers or celiac disease, as mentioned earlier. Assuming that's all been ruled out, symptoms include typically abdominal pain, typically lower crampy abdominal pain, changes in stool frequency. Sometimes you see changes in the form of the stool, bloating and flatulence being the more common symptoms. But one thing I might add is if we have to absolutely rule out red flags first, red flag symptoms first.
Now, what about complications with, say, diabetes? Is that type 1 or 2? Is that a problem, or how does that intertwine, or does it, with IBS?
Again, there is a correlation with an entity called small bowel bacterial overgrowth, which it can have a similar presentation as IBS in the sense that when you have diabetes, the nerves in the gastrointestinal tract don't, again, going back to this motility concept, the contractility is affected. And that allows a certain amount of bacteria to populate in the digestive tract, allowing it to produce hydrogen gas, methane gas. So it can cause diarrhea, it can cause bloating, but typically I would say it's a separate entity from irritable bowel syndrome, but it can have similar presentations.
Okay, so basically it's like anything else, monitor it carefully.
Absolutely.
Absolutely.
Dave, I just want to add one thing. Over the course of our practice at La Vie, we have seen several patients who were mislabeled with IBS, and unfortunately they were not IBS. After thorough investigation, they ended up being either celiac disease or Crohn's. So that's why it is critical not to call this diagnosis of IBS by yourself as a patient, or just to settle with a brief consultation with your family practitioner, or a brief encounter by a general gastroenterologist and label it as IBS.
It's
important to have the proper testing,
absolutely,
and determine whether it's IBS versus small bowel, small intestinal bacterial overgrowth versus celiac versus Crohn's or anything else.
Now, it's important to know too, if a listener feels that they have what might be considered a symptom, to get on the phone and call your office right away.
You're right. Because you need the right diagnosis.
Absolutely, absolutely. Now, we mentioned stress earlier, Dr. Kadhim, as being a trigger. It seems that more and more people today are experiencing higher levels of stress. Will that in itself be a major contributing factor, do you think?
Absolutely, if not the contributing factor. I have long discussions and conversations with my patient regarding ways to cope and manage stress, because once you get that under control, your nervous system will calm down. So I tell my patients, do yoga if you have to, exercise, go to the gym, do some biking, because, Dave, what ends up happening is it turns into a vicious cycle.
Yeah.
You become stressed, your symptoms happen, you become more stressed because you're having symptoms, and the cycle propagates. And dealing with stress is the number one thing that would help control this condition.
What about symptoms outside of digestive systems? I'm thinking conditions like sleep disturbances, maybe back pain or so on. Are these things, too, that are complicating factors?
Definitely they might be, because, if you have pain or chronic injury or lack of sleep, these things contribute to hyperactive nerves and therefore exacerbate that condition.
What about dealing with the pain? Now, this has got to be something that would affect a lot of folks that have IBS. What are some of the ways that pain manifests itself with IBS?
So typically it's lower abdominal cramping, so like suprapubic area. Typically, most of the patients say that the pain intensifies when they're about to have a bowel movement, but then after they go, it eases up. That's the quality of the pain. Typically, they don't have what we call nocturnal symptoms or symptoms when they're sleeping, because if the pain is bad enough to wake you up from sleep, then you have to think something else is going on and not just irritable bowel syndrome. Now,
what about food digestion? That will trigger pain as well.
Absolutely. So that's another pillar in the treatment of irritable bowel syndrome. So FODMAPs, which are a group of foods that are short chain carbohydrates. So they're fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. What happens is if we consume these products, Number one, they get fermented by the bacteria in our digestive tract, and they draw water, so they can contribute to symptoms. So I tell a lot of my patients to really make a log and watch out and see what they're eating, and then try to avoid the triggers. And following a low FODMAP diet is a good start.
Oh, wow. Makes sense to me, and we're going to discuss more detail of gastronomical issues, gastrointestinal cancers in particular, coming up after the break on News Talk 580 CFRA. And our guest this hour, Dr. Hassan Sannoufi. He's the co-founder of La Vie Health here in Ottawa, 2 locations, and Dr. Ahmed Kadhim. He's a gastroenterologist with Dr. Sannoufi's La Vie Health. We'll be right back on News Talk 580 CFRA.
We'll return with more experts on call on News Talk 580 CFRA. Now back to experts on call on News Talk 580 CFRA.
And good afternoon to you once again. If you're just joining us, interesting conversation, crucial conversation actually, because it affects just about all of us or will at one time or another. Dr. Hassan Sannoufi, he's the co-founder of La Vie Health, and his guest this hour is Dr. Ahmed Kadhim. He's a gastroenterologist, and we're talking about irritable bowel syndrome and its causes and its effects and what to do about it and how to deal with it and understanding pain and trying to feel as best we can in the midst of an affliction that I guess, Dr. Kadhim, is something that affects an awful lot of people.
Yes, of course. It's very common, and it can, I tell my patients, it's not going to kill you. It's not something that you're going to die from, but it's something that's inconvenient to live with. You can't function, and you're constantly looking for the bathroom. Yeah. So it can raise a burden.
Now, of course, the other end of that spectrum as well, we get into the potential or possibility, perhaps, of a cancer of some type. What about colorectal cancer screening? Maybe we could talk about that.
So excellent question, Dave. So before I answer that question, it's really important we understand how cancer or how colon cancer develops. So we have this theory. It's called the adenoma cancer theory. So what happens is cancer starts out as a small growth called a polyp, and that polyp grows over a number of years, and then it will develop into cancer. Now, putting that aside, screening looks at cost, especially with our healthcare system here in Canada. When we implement a screening protocol, we take cost. In fact, cost is the factor. So there are multiple ways to screen for colon cancer. So I'm sure some of the patients may have heard with the guaiac cards, where you have to provide stool samples and they get tested for blood in the stool. I personally think that these tests have low sensitivity and specificity in the sense that they could be confounded by a lot of factors, and they're not very accurate, because our goal is to directly visualize the growth or the polyp and remove it before it turns into cancer. And I think the gold standard is a colonoscopy.
So with a colonoscopy, if the doctor discovers polyps along the way and they are benign, get them removed anyway, get them out of there.
Absolutely. So the polyps usually, so the colonoscopy is actually a short procedure. It's about a 10 to 15-minute procedure. The patient would be sedated, and any abnormal growth would be removed. And it gives us the opportunity to directly visualize the colon. So you don't have to count on blood in the stool or other CT scans that look indirectly into the colon. We have a direct visualization. If we see an abnormal growth, we remove it, we analyze it. In fact, it's something that we're moving towards with La Vie, establishing an endoscopy suite. So that way we can see more patients and they can see us at a lot sooner time slot than having to wait and go through all the loopholes that they usually go through.
Oh, that's excellent. That's excellent news. Any idea, Dr. Sannoufi, when that might happen? Or is it too early to tell just yet?
No, actually, it's work in process, and I think we're hoping to accomplish that in the next few months.
Okay.
Yeah.
Now, Dr. Kadhim, getting back to colonoscopy for just a second here, how frequent should they be? Is it age-specific?
So 2 components. One is age-specific, and 2 is family history-specific. Okay. So now, please, I need to clarify that. It's extremely important. If you're having symptoms that warrants a colonoscopy, that's a whole different pathway. Whether it's bleeding or if you have Crohn's disease or ulcerative colitis, you don't need to wait till you're a certain age to have a colonoscopic examination. But sticking with colon cancer, average population, we say at 50, even though now the American Cancer Society came up with new guidelines that's starting at age 45 because there has been a trend of younger people developing colon cancer. But for the most part, average risk individuals, 50 years of age.
Now, being that it's moving down to a younger age, would that be because of diet, perhaps, lifestyle issues, and how they maybe have changed over the past few years?
Absolutely. So that's one part. The other part is there is a genetic predisposition to develop cancer, but we know along the way there is an environmental hit that happens, whether it's pollution, whether it's diet. We don't know. The jury's out on that. But that is causing an increase in the cancer rates amongst the young people.
Now, what about pancreatic cancer, stomach cancer, small intestine, bowel cancer? These are all associated too. They can't be discovered or at least pinpointed in a colonoscopy, I don't think, or can they?
There are different ways to test for different gastrointestinal cancer. You know, Dave, the frustrating part about gastrointestinal cancers, we pick them up when it's too late. Because think about it. By the time you develop symptoms of nausea, vomiting, blood in the stool, abdominal pain, the cancer would have grown into a significant size. So there are guidelines to test for pancreatic cancer. There are guidelines to test for gastric cancer by doing an upper endoscopy. And we also I look at the patient and I have a comprehensive approach regarding a detailed history because family history really matters.
Now, would a blood test determine or at least answer some questions, or what is involved in getting tested?
So it depends on the area we're going to test. So if we're thinking, for example, about pancreatic cancer, if I have a patient who has a first-degree relative who had pancreatic cancer, we do blood work to check them for any pancreatic abnormalities. And typically a low-dose CT scan, even though a lot of guidelines don't advocate for it, is useful every couple of years to examine the anatomy of the pancreas and to make sure that there is no early lesions which could be cured.
Now, are there any obvious warning signs? You've talked about some, but I'm wondering is there any one trigger that should turn heads and say, wait a minute, this could be an issue? Is there any one in particular?
So there's a few actually. So it's like a probability. So the younger a person is, the less likely that they have cancer, even though anything can happen. But the older a person or an individual gets, the higher likelihood of us being worried about cancer. So clinically, alarm-like features include things like significant weight loss. Because if you think about it, the digestive system, if it's functioning, you should gain weight and you shouldn't lose weight. Blood in the stool or vomiting blood, things like fevers, chills, night sweats, things like difficulty swallowing. So all these are clinical things that we look for.
I see. I guess, my question was really gastrointestinal cancer, how can it be diagnosed? What is the treatment? You kind of answered that, really. But it's something that definitely has to be monitored carefully. And I guess prevention would certainly be a good practice. But how would one prevent that? Or can one prevent that?
Absolutely. And that's where we come in at Lavi. You know, we talk to the patient, get a comprehensive history from them, sit and listen to them. Unfortunately, physicians nowadays are very, very busy and don't have time to listen. But I think it's really important to listen to the patient, get a detailed history, get a dietary history, and listen to their symptoms. And then based on that will dictate the next course of action.
And Dr. Sannoufi, this is something that Lavi prides itself in, too. It's all part of this preventative overview on each individual patient. They have their own score, where they're at, and what may happen.
This is our vision, absolutely. We have moved forward with that. So now we have also a urologist, Dr. Jean-Pierre, who is responsible for prostate genitourinary tract cancer prevention, and also Dr. Angel Arnaud, who's well-known breast cancer specialist and researcher. Her goal is focusing on breast cancer early detection, prevention, even also on second medical opinion as well as treatment.
Wow. From a prevention standpoint or a best practice standpoint, Dr. Kadhim, are there environmental things that folks should be thinking of? And I'm thinking maybe of diet. Getting lots of sleep, getting good rest. I mean, are there some basic things that good health practices would lead to maybe a lesser degree of gastronomical issues?
Yeah, I mean, with colorectal cancer, one of the risk factors that have been established are diets that are rich in red meats. So it's an imbalanced diet that doesn't have enough fruits, enough vegetables, enough fibers, and concentrates on high quality of red meats. Mm-hmm. So having a balanced diet is extremely important, number one. Number two, excessive alcohol consumption. It's definitely a bad player in the gastrointestinal in the gastrointestinal cancer world. Smoking is also something that can increase your risk of cancer. So these are factors that we can control. Now, obviously, unfortunately, there are factors that are predisposed genetically and we cannot control, but that's where the early prevention comes in.
What about something specific like stomach cancer? All of a sudden, I'm hearing more and more folks these days that are diagnosed with stomach cancer. Why is that?
Again, I think diet is a big component. So interestingly enough, gastric cancer, stomach cancer, is common in the East. So Japanese individuals are in Japan, and one theory was because of consuming smoked fish. Oh. That's part of it. But now as our diet changes, also there's a bacteria that affects the stomach sometimes called H. pylori. Sometimes that bacteria can turn into what we call a malt lymphoma, mm-hmm. Where it can cause cancer in the stomach. So to diagnose it, taking a detailed history, doing an endoscopic examination with biopsies. But you're absolutely right. That has taken a trend upwards. So is esophageal cancer. It's actually on the rise. Interesting
conversation. And we have more to come on News Talk 580 CFRA. And our guests in studio, Dr. Hassan Sannoufi, the co-founder of La Vie Health here in Ottawa, 2 locations, and Dr. Ahmed Kadhim. He's a gastroenterologist. Experts on Call is the program on News Talk 580 CFRA. We'll be right back.
Now back to Experts on Call on News Talk 580 CFRA.
Experts on Call, certainly, and Dr. Hassan Sannoufi is in the studio with us. He's the co-founder of La Vie Health, and with him, Dr. Ahmed Kadhim, and he's a gastroenterologist. A rather very interesting conversation on something that affects, I would say, Dr. Kadhim, 90% of us. I would
Probably
say
so.
That's pretty high. Predominantly on the female side, you were saying earlier?
2 to 1.
2 to 1?
Yes.
That much?
Yes, absolutely.
Really? But it doesn't escape itself from the male side at all. You know, you got to keep an eye on these things as well. But I think proper testing is the key for this.
Yes.
And what do you recommend for that?
So, dyspepsia and upset stomach, my advice to the patient is don't self-diagnose. It's really important to meet with your healthcare provider. Make sure that it's not something serious. First of all, things like H. pylori infection that needs to be tested and treated because that can cause upset stomach. But also remember the alarm-like features or the red flags. If you display any of these flags, I would certainly recommend an upper endoscopy to look into the stomach linings and make sure that there's nothing serious going on.
That's interesting, an upper endoscopy. Now, that's the upper part of the digestive tract? Is that
right.
what that is?
It's a flexible scope that examines your esophagus, stomach, and small part of the small intestine called the duodenum. And it looks typically for ulcers or inflammation or irritation of the stomach, which we call gastritis.
Now, what about things like taking antacid pills? Sometimes, it'll go away. I just have an upset stomach. But if you see yourself over a period of time taking a lot of these things, that in itself has got to be a danger sign.
Absolutely. So, with reflux typically or dyspepsia, diet is the key. So modification of diet, not to eat late at night, having a good balance of fruits and vegetables and that sort of thing. But antacids work and they're effective. But you're absolutely right, Dave. If symptoms persist and there is something not right going on, make sure you seek your healthcare provider because there could be something else going on.
You touched on something that's really interesting, and I'm guilty of this too, and it's sometimes that midnight snack. And then, you go to bed shortly after that, not necessarily the best thing for the body.
No, absolutely not. You need to have at least 3 to 4 hour period before you go to bed because it's all a game of gravity. So after you have your dinner, all the acid is secreted into your stomach, and when we lie flat, that acid will get to travel into your chest and
Okay.
cause heartburn and upset stomach. So my advice is not to eat too late and have at least 3 to 4 hour period gap before bedtime. So that way.
Now, if someone wants a mid-evening snack, they should try and have something that's not going to affect them gastronomically. I'm thinking like something you wouldn't eat a half an onion or something with a piece of garlic, for example.
Or even an ice cream. You don't want to do that at nighttime. But, feel free to snack on fruits and vegetables. I think they're very healthy. They sit well in the stomach, and they don't cause a lot of symptoms.
Absolutely. Now, we only have a little bit of time left. And Dr. Sannoufi, I just want to review, for new listeners or for folks that are just joining us, some of the services that La Vie Health provides.
So, again, we've been in the market for 12 years, and we have expanded now. We have 2 clinics and in the process of opening a 3rd clinic. Hopefully, we're looking into like early 2020. Mm-hmm. Also, we're working with Dr. Kadhim to open up our endoscopy suite in the coming few months. And for this, it's very important because if someone requires a screening colonoscopy, they don't require a referral by their family doctor. They can call our clinic, and we can set them up for a screening colonoscopy, as long as they fit the criteria for that. Now, obviously, we have several services at La Vie. Mm-hmm. We offer our patients a comprehensive wellness assessment, which has been the leader in the industry here in Ottawa. And this is a very in-depth evaluation of their health with a very detailed action plan that they live with, that we execute for them. It's a 4-hour assessment, very detailed, in-depth, and it touches on every single aspect of their health. And it's very proactive, as well as we have recently signed an agreement, and we are the only clinic in Ottawa that has this agreement with Claxon Hepburn Hospital, which is in Ogdensburg. Mm-hmm. Now we have an access to all of their services, where we can expedite any testing that is required and any specialist referral for our patients, as well as, like I said earlier, we're adding more and more of our local specialists to our team. We have so far like 5 or 6 different specialists, and we guarantee for our patients is to have within 1 week to have a consultation with a specialist.
Now, when someone comes in for a wellness overview with you, one of your programs, if there are triggers that are seen from a gastronomical perspective, then these are things that are noted, and perhaps Dr. Kadhim will be brought on board as might be needed.
Yes, exactly, indeed. So as we were talking, it's a very common problem, the motility issue and the gastrointestinal issue. That's why we have reached out to Dr. Kadhim. He's the only one actually in Ottawa who has subspecialty in IBS and motility. Fantastic. So Dr. Kadhim is not just a general gastroenterologist. Obviously, he has the knowledge of gastroenterology, but also he has a specialty in motility and IBS.
Now, you can be contacted through La Vie.
Yes, that's right, Dave.
And what is the La Vie phone number for those that perhaps don't have it handy?
So 613-592-0862. This is for our Canada clinic. Okay. And for our Slater clinic, 231-3666.
Wow, that's fantastic.
So 613-231-3666.
It sounds like you folks are busy, and this new clinic that you're talking about in the coming months for gastrointestinal issues?
For the colonoscopy and upper endoscopy. Yeah, we're hoping to open that up in the next few months, 2 or 3 months, hopefully. We're just working on the details. We do have the space for it, and Dr. Kadhim is going to lead this clinic.
Now, there's lots of good information on your website as well about general health issues. Your blog page, I found, Dr. Sannoufi, very interesting. I mean, there's a lot of good stuff in there, folks that have contributed to it. And I'm looking certainly forward to seeing more information on Dr. Kadhim, some of the things that are important from a gastrointestinal perspective as well.
Yes, absolutely. And we'll be in touch and reach out with our patients and give them the guidance that they need to hopefully have a good digestive health.
Absolutely. There you go. That's all we need. Well, Dr. Ahmed Kadhim, thank you so much for coming by. I appreciate your visit this afternoon. Very informative, very interesting.
Thanks for having me.
Dr. Sannoufi, always a pleasure to see you again. And best of luck you're very welcome, with your Slater location recently opened last year, and certainly your future plans. Sounds exciting. News is next on News Talk 580 CFRA.